The Australian Medical Association says Australia's ability to control the rampant coronavirus is being hampered because we don't have a centralised infection control body like other major Western countries. Their call for this coordinating centre is also being backed by the Australasian Society for Infectious Disease. To discuss this, I'm now joined by Newscorp National Health Correspondent Sue Dunlevy. Sue, thank you so much for joining me this afternoon.
Hi, Danica, how are you?
Good, thank you. Firstly, what exactly is a centralised infection control body?
Well, the idea is that you have a group of experts who are, the country's top infectious disease experts gathered in one place, in one organisation, coordinating the entire response to an infectious disease like the current coronavirus that we have from China, or in the case of Ebola when that was a problem, or the Zika virus. And they are the people that you go to if you need a comment on anything. They decide the policy on how governments are to respond to it. They do that in the United States. They've got a similar one in China and Europe, even though it has an overarching body that brings together all the experts in the different countries in Europe. And that's sort of the model that the Australian Medical Association and the Infectious Diseases body want here. They say that would be a lot cheaper than the CDC in America, and it would also allow the existing parts of that network, the people that we've seen at various hospitals who've managed to replicate the virus in a lab to share it with the world. We would, the people who are developing a vaccine, all of those people would continue to work in their own institutions, but they'd report to this central body who would control the messaging around this. And that's one of the reasons that we need a single voice on this. We've already seen in the last week, we've had conflicting messages from state and federal governments about whether kids who've been to China should be able to go to school. Some states said no, other states said yes. We've had the federal minister for the Treasurer saying that there won't be any charges for the people that we might evacuate from Wuhan in China. But the Border Security Minister, Peter Dutton, says they will be charged $1,000. We've had the Premier of Queensland complaining that the federal government wasn't sharing with her the details of people who'd come into her state from China so she could chase up to make sure they'd got the messaging and hadn't caught the virus. The government denied that. But, those sorts of, that confusion and that mix-up sort of undermines public confidence in what they're being told about this. So in a public health crisis, you need a single, simple message that people can trust. And if you've got one state government saying one thing and another saying another, people don't know who to trust, and that undermines public confidence in how the outbreak's being managed.
Yeah,
that would be the advantage of a CDC.
Absolutely. There's certainly been a lot of confusion. Now, you have spoken to the AMA President, Dr. Tony Bartone. What did he have to say?
So he said that they've been arguing this for more than a decade, and I think so too has the Society for Infectious Diseases. They've been asking the government to look into this, but they've been getting pushback. So I think one of the reasons that the federal government may be concerned is they thought it might be a high-cost exercise. I think there's some suggestion that perhaps the Department of Health wouldn't like to have its role sort of farmed out to an outside organisation, so there might be a bit of bureaucratic pushback for it. So those are the sorts of reasons that it hasn't been embraced so far. That's what they've told me anyway.
Well, certainly we're going to be hearing more about this, and to read the article in full, pick up a copy of your local News Corp paper, News Corp Today. News Corp National Health Correspondent Sue Dunlevy, thank you so much for joining me.